There we are.
And welcome everybody to another incredible, I know it's going to be, obviously I don't know yet, but it's going to be part of the menopause series. And yet again, I'm absolutely delighted that Dr. Sandar has agreed to come and have another chat with us about this very important topic of menopause. And there's so many other things with women's health, mental health that we can be talking about. This evening's topic though is about the Mirena coil and its benefits and how it can be helping with some current issues that are going on. So, hello, how are you?
I am fine, thank you.
Excellent.
Nice weather. It's actually getting a little bit warm now.
Yeah, absolutely. I know. I pray for these times of year all of the time. And I just think make the most of it because it's cold, dark, wet and miserable for so long. I always want it to be this time of year. So yeah, I'm going to take it. I am. It's the best. Although I always end up going to bed at 9 o'clock and still seeing the sun's out. So I don't totally make the most of it all of the time. But sleep is a non-negotiable for me. So I do make sure.
That's very good. I get really bad when there is light. I'm like, what shall I do? I should do something.
I know. And it is so tempting. But yeah, I just think in my mind, when my alarm goes off at 5 a.m., I will not be best pleased with myself for not getting up then. So
that's very disciplined.
Yeah, I know. I've got to be strict. And I suppose having a 6-year-old as well really does help to make sure that we're all in line. But anyway, on to this evening's topic. So yeah, I'm going to let you just kind of go with it now. I know you're going to be talking about the Mirena coil and so many things. So I'm going to hand over to you.
Right. The reason I wanted to talk about the Mirena coil today is mainly because the progesterone part of HRT is having a bit of a difficulty at the moment.
Yeah.
So as we've been talking a lot about HRT, so I am assuming that everybody has got up on the fact that the HRT involves 3 hormones: estrogen, progesterone, and the testosterone.
Yeah.
And the estrogen is the one that we really want to replace when we are in menopause. And even when you are in perimenopause, your estrogen starts to go down, you want to replace it. But if you replace the estrogen and if you have a uterus, you have to have some kind of progesterone so that your uterus lining doesn't get so thickened.
Yeah. Can I ask as well? I don't know if we've covered it or if some of the girls know about explaining about how and why somebody would have a uterus and wouldn't as well, because I'm not too certain if some may know what that difference is there.
Yes. So some of us may actually be born without it. That doesn't necessarily mean that you wouldn't go through a menopause, because as long as you have your ovaries, you still would go through a menopause.
Yeah.
So we were born with the ovary and the uterus. The ovaries are the ones that would secrete those hormones. And as you come into the age between 45 to 55, your ovaries would cease producing these hormones. And in between, some people would have their uterus taken out for so many reasons. Either as a complication during childbirth, or you could develop a fibroid, which is like a non-cancer, just a fleshy thing that can make you bleed a lot. Some people don't even have a reason. They just bleed so much that there is no other way to stop that bleed. They had to take their uterus out. And there may be other causes like cancers where you would have your uterus taken out. So there are so many reasons where you wouldn't have a uterus. And a lot of that is because you had a surgery to take them out. So if you don't have a uterus, you don't have to worry about the progesterone. But if you do have a uterus, you would need to protect the lining of the uterus, because if it gets so thickened, that would make you bleed. That will make you prone to cancer as well. So the whole idea of having the progesterone is to protect the lining of the uterus. And we could do that in several ways. You can have a tablet, a progesterone capsule that's called Utrogestin. That is the best one available at the moment. That is very body identical. Right. The only problem is because it's so good, everybody on HRT would like to be on that, and the supply is not actually catching up. So the government has now put on a regulation that people can only have Utrogestin 2 months supply at a time.
Yeah.
We're not very sure when the supply is going to come back. And there might be a time that we wouldn't get the Utrogestin. There are other alternatives. There are other alternative progesterones, as in tablets, capsules, or you can have them in patches as well. The only difference is all of those ones are not actually body identical.
Right.
So if you were so used to having body identical progesterone, and all of a sudden, if you have to change into something not body identical, you might find side effects with it. Mainly the side effects are like bloating, headaches, mood changes, bleeding issues. That's where the Mirena comes in. There is one tablet which has got body identical estrogen and the progesterone. So some people who can take tablets will still be okay.
Yeah.
Those people who can't actually take estrogen in a tablet will have problems.
Yeah.
Because at the moment we're all doing pretty well with like this is the estrogen gel, and this is the estrogen spray.
Oh, okay.
So at the moment we're doing with the estrogen gel, estrogen spray, and then we go with the Utrogestin capsules.
Yeah.
Now we're not having Utrogestin capsules that easily. So the option for those people who can't have estrogen in a tablet form is to go on to patches, which are not body identical, or tablets of progesterone, which are not body identical. So that can give you bleeding issues and the mood problems. And a lot of the progestrogens actually give you bloating.
Right.
So that's why I want to talk about Mirena.
Yeah.
Mirena is the progesterone coil, which actually stays in your uterus. So if I show you this is what your uterus look like.
Yeah.
And the actual uterus in your body is a little bit bigger than that. So don't think like this coil is just going to sit in your uterus and completely occupy it. The actual uterus is about this size at least.
Okie dokie.
So this little coil, if I take it out, it's just that. That is the only bit that is going to sit in your body.
Yeah.
The actual Mirena is white. They made this prop in color to make it very, very clear that this is not something that goes into your body. Okay, so that is what's actually going to sit in your uterus just like that. And that little bit that is dangling down there is the bit that stays in the vagina.
Yeah.
And when we take it out, we just grab that and we pull it out.
And it comes out easy when that's done then,
Very
isn't it?
easy. That's basically just what I'm going to do if I take it out. So I grab this little flagella at the end, and then you just pull it and it just comes out. The plastic here is very, very soft. So, you know, when it actually comes down to your vagina, it will just close itself. It won't be like coming out all flat like that. It will just be closing itself and it'll just come out. So that is all it is going to sit in your body. And, you know, women has had bleeding all their life, and you have had babies, which are a whole lot bigger than this.
Yeah.
So to actually put this in isn't such a big thing.
Yeah.
And we are all very used to having cervical smears.
Of course.
And the cervical smear basically would be like, if you look in your vagina like that.
Yeah.
So in the cervical smear, you'll be like rubbing around in this area to get the smear. When you're actually put in the coil in, that coil just quickly go through there. And this is the time it actually takes, just that.
As quick as that. So does it feel a bit like having a smear when you have that done then?
It will feel a bit like a smear,
Yeah.
but yes, that one little bit, it'll be like somebody injected something in you.
Yeah.
That's basically it.
Yeah.
And then after that, because something went inside your uterus, you feel a little bit like a crampy pain, like a period pain.
Yeah.
That's basically it.
Yeah.
So there are a lot of horror stories about it. And that's what I want to like explain.
Yeah.
So the Mirena coil, it is this big. There is something else called Kylina or a JDES. So unless you actually compare them, you wouldn't see a difference. So if you compare them, the Kyleena is just a tiny little bit smaller.
Okay.
This is the Mirena, this is the Kyleena. The tiny little bit smaller one also come in with a smaller inserter. So it's a little less scary.
Fab.
The only difference is these ones, the smaller ones, are only licensed for contraception.
Right.
The little bit
Okay.
bigger ones are actually licensed for contraception and also as a part of your HRT.
And what's the difference between them for why that is?
This one has got a little bit more hormone in it.
Okay.
This one a little bit less, this one's a little bit more. So this lasts a bit longer, this lasts a little bit shorter.
Okay.
But if you have like a younger person who has never given birth, I probably go with the smaller one.
Yeah.
And because they have got less of the hormone, their bleeding control isn't very good. So if you have got like somebody who's been having heavy bleeding, this is the one I would go for.
Yeah.
Somebody is having bleeding irregularity, either using it using a contraception or either using the progesterone as part of your HRT. If you are having bleeding irregularity, this is the Mirena would be my go-to thing.
Yeah.
Rather than any other progesterone tablet or a progesterone injection. If you are having bleeding irregularity, the implant is definitely a no-no because it actually gives you more irregularity.
Okay.
So this one is pretty good with menopause because around the time of menopause, perimenopause, you're going to have like irregular bleeds.
Yeah.
So this one will do the job. Another good thing about this is that if you double your estrogen gel or the estrogen spray, it comes to a degree that you have to double your progesterone tablets as well. So when you double your progesterone tablets, you would have double the side effects. So you'll be like more bloaty. You would have more of the mood problems. But with the Mirena, you don't have to double it.
Yeah.
One Mirena will just do the job of regardless of whatever dose of estrogen that you're on. The progesterone in it just stays in the uterus. And what it does is that it stays in the uterus and it acts like an actual obstruction for you in getting pregnant. So that will act as the contraception. So if you are a perimenopause and if we're still worried about you probably getting pregnant, this is a good one.
Yeah.
Otherwise, you'll be on an HRT. You'll also be on a contraception. With this, you actually kill all the birds with one stone.
Yeah. Brilliant.
So you will be having less of a bleed, or you might not bleed at all. And you would have a contraception as well. And it will actually put the hormone in the lining of your uterus. So you won't have to worry about the thickening of the uterus lining.
Yeah.
It makes the cervical mucus a little bit thicker. That's another way that it would prevent you from getting pregnant.
Right.
So with this, the systemic side effects are a lot less. So for contraception, you can have it for 5 years. For part of the hormone replacement therapy, the license was for 4 years, but the Faculty of Sexual and Reproductive Health says everything is okay for 5 years. It can be okay even up to 6 years. So there is no hurry, like, oh, mine is like a 5 year and a month and I must go and get that thing out straight away and all that is not.
Yeah.
And some people are very, very afraid that what if you lose this little string? If you lose the string and if we can't pull it out, what's going to happen?
Yeah.
Actually, other than the fact that this thing doesn't do what you want it to do, it really doesn't harm you.
Yeah.
So it's okay.
Yeah.
Just because it's there doesn't mean like you would have any harm from it. It's just that, we need it to be functioning to do the job that we want.
Yeah.
And for women who are still in the reproductive age, we do have to explain to them about ectopic pregnancy because people tend to worry that if you have a coil inside your uterus, would it make you more prone to ectopic pregnancy? It doesn't actually make you more prone. It's basically the same thing.
Yeah.
Yes, you can have ectopic pregnancy with it, but it doesn't actually increase your risk higher or anything.
Yeah.
Okay.
Yeah.
Mhm. Somebody has asked, can you still have HRT with the copper coil? The Mirena coil didn't work for me. Well, you can still have the HRT with the copper coil, which is fine. You just need to have your HRT in 2 hormones. Mirena would have worked as part of the one of the HRT. So in your case, you will need your estrogen and the progesterone in a different form. At the moment, we are still allowed to have a 2 month supply of Utrogestin at a time. So you could be using either the gel or the spray and the Utrogestin in a capsule form. And if you are perimenopause and if we are still worried that you might be able to get pregnant, we keep your copper coil. If you are in complete menopause and you are not going to get pregnant, you don't need the copper coil, you can take it out. If for any reason that copper coil is stuck and if anybody can't take it out, it's still okay.
Right. Okay. It's good to know.
Just don't worry about it.
Yeah.
Okay.
Yeah.
Right. So what I also want to talk about is like, so this is the background about the Mirena. There are other two coils which are exactly the same as the Mirena. They just have different names. So it's fine as long as your doctor says it's the same as the Mirena and it will last for 5 years and it can be part of your contraception, your HRT, your bleeding management. It's all fine. Just go for it. The Kylina and the Jades are the two which are smaller ones, which I usually use for younger female. They are not the ones for bleeding control or HRT. It's just because they have got less of the hormone. They're just good for the contraception. Right. What I want to say now is like actual procedure. People tend to get very, very worried about the actual procedure.
Yeah.
So first of all, you can't be pregnant because in the UK, if you're pregnant and if somebody put a coil in, that means that we're inducing abortion and we shouldn't be doing that.
Of course. Yeah. Yeah.
So make sure that you're not pregnant. So how can you make sure that you're not pregnant? If you haven't had any sex in the last 3 weeks after your period, that's pretty good. You can basically say that, yes, I'm not pregnant. If you happen to have sex in the last 3 weeks, haven't used any kind of contraception or a condom, your doctor will say that, well, we need to do a pregnancy test.
Yeah.
Pregnancy tests are good only up to about 3 weeks. So anything less than 3 weeks, it won't detect it.
Yeah.
So if you happen to have sex like last week or yesterday or something, we can't really do much about it.
Yeah.
So we'll have to say like, okay, we'll do a pregnancy test today. From now on, you use condoms and we'll do another test in the next 1 week or 2 weeks, depending on your last sexual intercourse. So that's how you exclude it. Another thing you need to make sure before you put a coil in somebody is sexually transmitted diseases, especially chlamydia or gonorrhea. So if you have had like if you are in a relationship with a regular partner and if you completely trust this partner and you don't have any new discharge, new irritation or anything, you could say to your doctor that, well, I'm pretty sure I don't have any infection. If you're not very sure though, it's a good thing to have the swabs first and wait until the swab results come back. And if they're all negative, good.
Yeah.
Otherwise, if you have an infection near your cervix, and if you just like put something through that way, you'll be like putting an infection which is inside into your uterus directly. And an inflamed uterus is not a good thing.
Oh gosh. Yeah.
Yeah. So the two things you exclude, pregnancy and the infection.
Yeah.
Once you haven't got any of those, we're fine. We can go for it. You can either have it done in your GP surgery or you can have it done in sexual health clinics or family planning clinics. Some gynae doctors will do it while they're doing something on you. If somebody had a termination of pregnancy, after the termination, they tend to ask you like what sort of contraception you want. And if you choose this, they will put you in on the list and they'll do it. Okay, so how do we put it in? Okay, so if anybody gets scared about these things, don't watch. Okay. Right, so this is the big thing that comes with it. So it's actually spelled Mirena. You will see it like in a different way. Okay, so that's a box, and that box should be like completely closed. And if you go to like sexual health clinic, or if you go to a family planning clinic, they would have their own stock. But if you are with a GP surgery, the doctor might give you a script. If you've been given a script, make sure that you actually went and got this Mirena before you go to your clinic. Otherwise, they wouldn't have the Mirena to put in you.
Ah, okay, okay.
And when you do get the box, don't get so scared. Not the whole thing is going to go in you.
I was
Okay.
going to say, that's quite a big box.
Yes. It's mainly for the person who is going to put it in,
Yeah.
because this thing has to go through your vagina
Yeah.
and actually pass your cervix and go into the uterus. So you do need something pretty long to pass through all of that.
Yeah, there's a journey
Okay.
there.
And you may want to look at it. That's okay. You can open the box. You can look at it. It comes with a little booklet. And that little booklet has a space where we can put your name, date of insertion. And on the back of it, it has got a little calendar. And what we do is on the day we put in, we circle the date that we put in, and then we would put a cross for the 6 weeks time, because that's where you should go back and have your checkup.
Oh,
And just to make sure that everything's good. We do the checkup after your first period, because the periods vary. Some people's periods are quite heavy. And at that time, your Mirena might not be very stable, so it might come down with your period. So we want to do the checkup after the period. And then this thing will last you for 5 years. So the date that you're supposed to take it out, we'll put it up here. And there is also a little card that comes with it. So we would advise that you keep that in your wallet. 5 years is a very, very long time. So you might forget it. So if you change your wallet, always make sure you put this back in. Okay.
Yeah.
It has, your doctor will actually put on their name, your a contact number for you to contact your surgery if anything goes wrong, and the date that it should come back out, your checkup date, and we'll also put in the batch number and the expiry date on this thing. So if anything goes wrong, at least you can trace it with that.
Yeah.
So if you want to open it, that's fine. You can open that one. But this bit, the bit that comes in with the Mirena, the plastic bit, don't open that, because that is what is actually keeping it sterile. Okay. Right. So this is what the Mirena looks like.
Wowzers.
It's okay. That's not all the thing that actually goes inside you. So that thing actually comes in a little bit open like that.
Yeah.
And the doctor, before they put it in, will make it close. So before that, I would say take some ibuprofen about like 1 hour, 30 minutes before you go to the for the procedure. That will help a bit.
Yeah.
And don't get too worried. But I would usually say, like, you don't know how your body reacts. So try not to go there driving yourself. It'll be a good idea for somebody to drive you there. Because after that, your legs might be a little like jelly, or you could be having a tummy pain and all that, and not a good time to drive. Okay. And then the ibuprofen, I would say that night, and probably about like 2 days after the procedure, keep taking it. Basically, it would be like inducing a period pain. So when you got pain, you got to be scared. If you don't have pain, you're fine. And we do give some local anesthetic. There are different ways of giving local anesthetic. Some people use gel, some people use spray, some people actually inject the local anesthetic. I don't actually use the spray because the spray can give you a bit of a dizzy head or headache. The actual procedure is making the woman scared enough, so I don't want to make them any more dizzy.
Yeah.
And the injection as well, I don't think it's actually worth the pain. The whole procedure isn't that bad.
Yeah.
So I usually use a gel. So the gel, we put the gel in with some tube which is pretty much similar to that. So the gel, I would take it up with a syringe, and then I will attach a little nozzle this much like that to the syringe. And then let's say this is your vagina, so it will just basically go in like that. And then just this, I chose this because this actually looks very much like what it is in the vagina and your cervix. So you go up like that, and then you want to go up here, and you just numb that area, and then you wait for about like 3 minutes. So it's numbed. And then the next thing we do is something called a uterine sound. Basically, it's sounding out the idea. So before I do the whole procedure, I would actually do an internal anyway.
Yeah.
Just to see which way everything is heading. So if your uterus is this way, I will be putting things this way. If your uterus is this way, I will do it this way.
Yeah.
So as long as I know the direction, it's much easier. I might ask, if somebody says like, oh, I can't find your cervix, try making a fist with both hands and sit on it. That will make your cervix come up. So those are the little tricks that you do to make the whole procedure a lot easier.
Yeah.
There is something that you can use to grab hold of the cervix, but I don't normally use that because if you do it quick enough, everything will be fine. So there is a sound. The sound is going to be like a primer. After 3 minutes, the sound will go in. That would have actually prepped the cervix to let things go in. And then after that, we would have like, so this would have been open a little bit like that. And we would have closed that. And it will just go in. It's very quick, just like that. And then once it goes in, I'll move it out a little bit. It's basically a one-hand technique. So I would just open it up a little bit. You could see like it's open inside.
Yeah.
And then you move it up a little bit to stabilize it. And then you just open the whole thing out. And the only thing is it's supposed to be one hand, but because I'm actually holding this vagina as well.
Of course, yeah.
So you just like take the whole thing out. So this is the bit that would be staying inside.
Yeah.
And then you cut the strings. So
Oh,
the
right,
whole
okay.
process basically takes like a minute.
Yeah.
A minute is actually pushing it.
Yeah.
And if you have pain, that is all the pain you're going to have.
Yeah.
It's like if somebody put an injection into your cervix.
Yeah.
And then after that, there will be a little bit of crampy pain. And it is a good idea to just keep lying down until you're told by the doctor that you're okay to sit up.
Yeah.
Because the actual procedure of putting something into your cervix can make you feel a little bit fainty.
Yeah.
So if you like sit up straight away, you might feel like you're going to faint. We can tell by looking at the color of the person. So we tell them like just lie down while I'm cleaning everything up. You just lay there. And sometimes we might even ask you to like have your legs a little bit higher and your head a bit down so that the blood goes back to your brain. And after about like 5-10 minutes, your doctor said, well, sit up and see how you are. So sit up, put your things back on. And then after that, the doctor will move you back to your chair and give you all these booklets and things. And I would usually advise no sex for about a week.
Yeah.
Because things are not very stable by then. So you don't want to be hitting it.
Yeah.
And then if possible, don't use tampons after you have a coil, either a copper coil or Mirena coil or whatever coil. Some people manage to like hold their coil strings while they're taking out their tampons.
Oh my word, okay.
So I tend to like advise people, if you can, just use pads. But some people are like,
permanently then, not just for a little while after, but permanently, is it?
Better. But you know, after a little while, the strings will eventually curl themselves. Like they're not going to be dangling anymore. They'll be curling themselves up. Right. So your chances of pulling it out become a lot less.
Right. Okay.
Okay. That's basically it. It's very simple, straightforward. And when you come back out to take it out, you can have it out anytime. It's your body. Yes, just the thing lasts 5 years, but it doesn't really mean that you have to keep it for 5 years.
Of course.
You can take it out anytime you need. And if they can't find the string, the first thing we do is we got something called thread retriever. It's like a little plastic thing with some cars on it. So you put the thing in. When you pull it, hopefully the string will just get tangled in it and come out. If we can't do that, you would request an ultrasound just to make sure that everything is still inside, because most of the time you don't find the string because the string actually coalesces and go inside the uterus.
Yeah.
Or sometimes it actually gone out with your period and you just didn't know it.
Yeah.
So if that is the case, the ultrasound wouldn't show the coil inside the uterus.
Yeah.
And if you don't find it, we usually increase the area of the ultrasound just to make sure that it hasn't actually gone anywhere. Chances of a coil going past your uterus and getting somewhere is a very, very rare thing.
Yeah.
Only the people kept on emphasizing on that. So even if something goes out, it's still really not a problem. It's just a plastic thing.
Yeah.
It really doesn't harm you. So the actual harm out of a coil, very little.
Yeah.
And the only thing that might give you pain is that if you have got a coil which is a little bit stuck, like it tried to come out of your cervix and it couldn't come out because it's actually stuck because of the arms. That way it actually irritates you.
Right.
So if you got a pain which is pretty irritating, as if something is grating something and you want to wee so much and all that, just tell your doctor and they would have guessed that and they'll just pull it out.
Right.
That's it. And some people may have forgotten that they have got a coil and they probably left it for like 15 years and then they decided like, oh, I want to take it out.
Yeah.
In those people, it may be a bit hard to take it out because it might have like gone and embedded in your flesh.
Yeah, of course.
But an experienced person would know if something is stuck. The point is, if something is stuck, don't pull it.
Yeah.
I will need taking it out in the theater with a hysteroscope. Basically, you look at where you look at it with a little camera scope, and then you just grab it and take it out. So that's basically it.
Yeah. Oh, fabulous. Well, it's been so interesting. I've definitely learned a lot from this evening. And hopefully everybody watching and listening has as well. And I think it's, I mean, it sounds like a bit of a first choice. I think particularly for myself, where I'm at with my age, because of as a contraception as well. But, as an alternative, especially with the shortages that are out there, it gives you a bit of peace of mind, doesn't it?
Yeah. Yeah.
Excellent.
That's it. Any questions?
I don't have any questions. I don't know if anybody else has got any, if you wanted to add them into the chat. But if none come up by here now, what I can do is I can collect some of the questions that may come through from the girls later. But also there will be a lot of people listening to this as a podcast right now. So of course, anybody listening to this as a podcast, please do reach out with any questions. And I suppose before we do end this show now, it's going to be super important for everyone to know and be reminded, how can we find you? How can we follow you so that we can just be up to date? And of course, if we wanted to use and book in for one of your services, that we know how we can do that.
I have got a clinic in Santa Maria on Friday evenings, and mainly for women's health. And I also work for another company called IGP, and the IGP clinics are in Santa Maria on Tuesday mornings and in Cardiff Gate for Friday mornings. So yes, there are plenty of places you could come. And I've actually had a discussions with the Mirena rep. I asked her if she would give me proper props so that I could do a proper demonstration as to how to do the Mirena thing in, and explain about the all the different coils and everything. That one might be a bit more of a health professional teaching, but I think it will still be pretty good for the ladies to have a look, because at the moment I'm just making do with everything I got.
Of course.
Yeah, and I'm on Instagram, Facebook, literally everything. So yeah.
Amazing. Oh, that's wonderful. Well, of course, I mean, I'll put all of your details to the show notes of this as well, so people can literally just press on links, and all of us know where you are and are already hopefully following you as well. So on that note, I just want to thank you once again for a really interesting discussion this evening, and I hope that it's been super beneficial for the girls, and also look forward to more topics and discussions, because it's never ending, all of the things that we'd love to, get more help and advice with as women. And yeah, I look forward to more. So girlies, thank you so much for listening. And Dr. Sandel, thank you so much yet again for agreeing to chat with us. And it's been lovely. So
Very
well
much.
done, everybody. Thank you so much. And I will see you all again really, really